Hi everyone, welcome to yet another episode of Menopause Unfiltered. कुछ बातें जो हम नहीं कर पाते किसी से, यहाँ पे आपको उन सब के आंसर्स मिलेंगे एंड वी आर ट्राइंग टू गेट अप्रोच फ्रॉम एवरीबडी। आज बहुत स्पेशल गेस्ट है और वो आपको जेन्युइनली शायद मेरी स्माइल से भी दिख रहा हो। शी इज बीन an amazing mentor and the reason when I say that is she was the first Indian when I started researching about menopause in general who popped up on Google. He's been an ex-president of Indian Menopause Society. Let's welcome Dr. Sunila Khandelwal. Thank you so much, ma'am, for being here. It's an absolute honor.
Thank you, Tamanna. It's really a pleasure to be with you and with the audience, whosoever is interested in knowing this transition, the beautiful phase of life, the menopause, not as it is.
Yes. And you know the best part, ma'am, कि it's from my heart कि actually आपका नाम सबसे ऊपर आता है. Not many people would know the kind of work. It's been a fantastic, I think, 40 years journey for you. And
Yeah.
यू हैव बीन इंस्ट्रूमेंटल इन मूविंग दो स्टोन्स जहां लोगों ने सोचा नहीं था शायद उस टाइम पे तो बिल्कुल बात नहीं होती होगी लेकिन अब थोड़ा नॉर्मलाइज हो रहा है सो आपसे पहले जानना चाहेंगे हाउ इट ऑल स्टार्टेड एंड हाउ फ्रॉम अ गायनेकोलॉजिस्ट यू थॉट की मेनोपॉज पे स्पेशलाइजेशन एंड देन रीचिंग टू दिस साइड.
This journey, I must say, this journey was full of challenges and struggle. But of course, when I look back, I feel so contented. It was long back, 1995, when I was abroad, and I heard this thing that yes, the menopause subject is coming. That people are starting knowing this term and all. So when I came back to India, I found that we have Indian Menopause Society, which is supposed to be, few like-minded multi-specialty faculties working in Mumbai. They were looking for making this organization. So I was lucky enough to be one of the founder of this Indian Menopause Society, along with Dr. Ramavedya and Dr. Rishi Jha. So it was like in 1997, I opened the Jaipur chapter also, and the Indian Menopause Society has grown leaps and bounds now. And आज की तारीख में I think 6,000 members हैं, and around 52 local societies हैं, those who are working across the country. And the best beautiful part of this organization is it is a multi-specialty. Why? Because we all know menopause needs complete holistic health management, complete all system and organ have to be dealt with, and we have to treat women as a whole. So I started first menopause clinic in Rajasthan, and that was again in 97. And my journey is challenging because I resigned from the government job. People never resign from the
Resign.
government.
जी.
Yeah. So I was professor there. I resigned. I wanted to dedicate my whole energies and skills into this. Why? Because I thought it's a neglected segment.
जी.
And women, life expectancy of women is increasing, and now nearly one third of life we have ahead menopause.
जी.
So I was just thinking, average age which we have, Indian Menopause Society has done research,
जी.
and the data says that 46.7 years is the average age of menopause of Indian women,
Yes.
which is further more or less than the European and Western counterparts.
जी.
So we are having everything nearly, 10 years early than or maybe 8 years early, whether it is bone or it is heart or whatever, all the systems are being affected because of the estrogen deprivation. So I thought, what we have to serve these women, those who have done everything in their life, and now their one third of the life is ahead, and they I saw them miserable.
Yes.
And to be very honest, my mother was my inspiration. I saw
Wow.
him, I saw her in a very, very difficult phase of menopause transition. So I was
Okay.
just wondering, being a gynecologist, what is happening to her?
जी.
She was so confident. She was one of the, most learned women of India. She got award from president. She was a
Wow.
educationist. So, but I saw her in a like, hot flushes and episodes like mental irritability and all those things,
जी.
and her performance, everything. So I thought, yes, this is the area I have to work. And that was the day I started alone, I must say, but वही होता है ना कि हम अकेले चले थे और पूरा पूरा काफिला हमारे साथ हो लिया.
करता गया.
So I'm
जी.
thankful to all my colleagues, all my friends, all my medical fraternity who could understand my passion, and then we are working towards a better future of Indian women. And I must say, my passion is turning miserable lives into meaningful ones.
Wow, awesome, ma'am. That's so awesome. Actually, यहाँ पे मेरे दो lyrics रहे. आपने जो बोला, one is I think the myth and not many people would know कि आप बोल रहे 97, 98 when you started working with the Indian Menopause Society as a founding team member and taking it ahead. मतलब हम काम तो इस पे पहले से कर रहे थे. It's just that कि थोड़ा लाइमलाइट में अभी आने चीजें शुरू हुई हैं. But actually, it's passion of doctors like you who have been working and who is trying to make that change. थोड़ा शायद मीडिया या सोसाइटी या ज्यादा फ्रंट में नहीं आ पाया. सो आई थिंक दैट इज कमेंडेबल जॉब. तब से आप लोग कर रहे हैं. एंड सेकेंड, व्हेन यू मेंशन इट्स इंटरडिसिप्लिनरी, जो इंडियन मेनोपॉज
Yeah.
सोसाइटी है,
It's
दैट्स
a
अमेजिंग.
transdisciplinary approach
जी.
for menopausal health care.
जी जी जी. सो दैट इज ऑल्सो सो अमेजिंग टू नो. एंड आपने एक बड़ी इंपॉर्टेंट बात बोली कि वी आर गेटिंग मेनोपॉजल 5 to 10 years, 5 years earlier than our European counterparts or American
Hmm.
counterparts. तो इसी को आगे रखते हुए मैम, what do you think or what are the reasons why this is happening? Because ladies को काफी confusion रहता है या कई बार ये क्वेश्चन सामने आता है कि हम जल्दी क्यों हो रहा है, हमें जल्दी क्यों हो रहा है. So what are the major 3 or 5 reasons जो आपको लगते हैं that you've seen?
I think number one is genetic, because
Okay.
when I ask about the age of menopause, I always ask about what was your mother's age at menopause.
जी.
So that is
जी.
also important.
Okay.
And nowadays, age of menarche is also coming down, because pehle 16, 17 years mein age of menarche
जी.
thi, and now, the young girls, little girls, I must say, not young, little girls, they are getting menstruation.
जी.
So I think, and most importantly, I think, again, the environment, the pollution, the, our socio-cultural environment, our diet, these are all influencing factors which makes us different from our Western and European counterparts.
So मैम,
So
डाइट हमारी, इज इट वी आर ईटिंग अनहेल्थी? मतलब यंग एज में आजकल हम 8 पे 10 पे देख रहे हैं गर्ल्स को पीरियड्स आ जाते हैं, एंड बिकॉज ऑफ lot of awareness also that has happened around. I know a lot of my friends जिनकी daughters are as young as 7 or 8, and they're actually waiting कि their daughters are getting stressed कि हमारे नहीं आए, हमारी क्लास में सबके आगे पीरियड्स. The girls are also getting very conscious about it. But आपको ऐसे लगता है कि मतलब are we growing up faster? The young lot is just trying to reach
uh,
somewhere very fast.
I think there are factors, and they are proven factors, that number one is, the plastic use.
Hmm.
Number two, our fast food pattern. Now we
Hmm.
are going towards that.
जी.
And number three, genetic. And
Okay.
number four, most important, is stress.
Hmm. Hmm.
These are the
True.
four common important factors which are identified as, factors for early age of menarche. So
Okay.
overall, the ovaries, they have a definite lifespan of work. So if they start working early, they will
Die is
stop
not the
working.
right word, but they will stop early. I think I was just trying to find a right word.
Not
But
die.
yeah, I'm sorry. I have to take that. I think they
Yeah,
will
yeah,
stop
yeah.
functioning. Yeah. Or they will stop
They
functioning
will,
for the
means there
major
are
function.
limited number of ovarian follicles, if to
Yes.
be more on a scientific basis.
Yes.
So these number of follicles they decrease, and it is something very scary also, that the premature ovarian insufficiency or premature ovarian failure is causing premature menopause, that is even less than 40 years. So that is very scary, and a small subset of women, they are coming towards the premature ovarian insufficiency. That means very early, even 35, 40, they are stopping the period. From, if less than 40, it is premature ovarian failure or premature ovarian insufficiency. It's not normal.
Okay.
If it is from 40 to 45, it is called as early menopause. And after 45, it is like natural one. But one has to understand that in addition to the natural menopause, there are growing number of women, those who are having surgical menopause.
Okay.
So, day in and day out, there are hysterectomies done, ovarian resections are done, so many cancers are there, so chemotherapy, radiotherapy, these all cause iatrogenic menopause or induced menopause, which is not natural. And unfortunately, these women, they suffer a lot because there is sudden decline of hormones. In natural menopause, it is slowly, the ovaries
Fluctuations.
don't, stop function abruptly. They just slowly and slowly. That's why it takes 1 year. And that's why we define natural menopause, that if a lady has no periods for 1 year, then only it is called as menopause. There is a myth कि menopause हो रहा है तो periods मेरे irregular आ रहे हैं या ज्यादा आ रहे हैं, और मेरे फ्रेंड्स ने, मेरी मदर ने ये बताया कि जाते हुए तो परेशानी होती है. This is absolutely not correct. This myth has to be taken out from our society, that natural menopause means स्कैंटी होते होते बंद होकर के 1 साल तक अगर नहीं आएंगे तो हम नेचुरल मेनोपॉज बोलेंगे. ये नहीं कि हैवी आ रहे हैं, जल्दी आ रहे हैं. That is not. So one has to remove this myth from our conversation, that oh, this is normal, it happens when the period जाने का time होता है तो ऐसा ही होता है.
हम तो बहुत सुनते
So
मैम कि
this is
झेल
the
लो.
thing.
हाँ, कि
हाँ,
झेल लो, 2-3 साल की बात है, झेल लो. तुम तो पहले नहीं हो, झेल लो. हमने भी तो झेला था. व्हाट इज न्यू विद यू? एंड यू आर राइट, दिस नैरेटिव नीड्स टू चेंज. हम 21st सेंचुरी में क्यों झेल रहे हैं? देयर आर सो मेनी थिंग्स, देयर आर सो
झेलना
मेनी
वर्ड तो
ऑप्शंस.
बिल्कुल भी सही नहीं है. हम
जी.
वी आर लाइक educated, we are aware, we are responsible women, we are progressive women. We don't want to close our door for our profession or our social life or anything just because of menopause. So we have to remain active, we have to remain young, we have to be fit. So if the solutions are there, if we know what is happening, if we can prevent those changes, if we can we can opt right solution at the right time, then why to suffer? So this is very, very important. The most important thing is to break the silence.
Yeah. Yes. Normalize the
So
conversation and break the silence. Absolutely. I mean,
one has
बहुत
to
ज्यादा.
break the silence, and I
Yes.
think that's what we are doing here right now.
Yes, yes, absolutely. मैम, एक और मिथ है कि पहले तो लगता है लेडीज को कि मेरे 3 महीने 6 महीने पीरियड्स नहीं आए, बाय डेफिनेशन फॉर देम कि मेरा मेनोपॉज चल रहा है. So of course we know there are 3 phases: perimenopause, menopause, and postmenopause. But other than that, the duration, there is a lot of confusion कि कितना ड्यूरेशन होता है या कितना ड्यूरेशन रह सकता है. एंड वी आर टॉकिंग जनरली. किसी किसी का हमने देखा है 20% हंसते खेलते निकल जाएगा, और रेस्ट 80 it could be from moderate to really extreme conditions, right? But duration क्या रह सकता है where she can be mentally prepared just to know कि अच्छा इतना टाइम हो सकता है मुझे, wherein I can feel the symptoms.
देखिए, पेरीमेनोपॉज होता है 40 इयर्स से पहले, जो मैंने आपको बोला, दैट इज
जी.
कॉल्ड एज प्रीमेनोपॉज, नॉट पेरी,
Premenopause. जी. जी.
प्रीमेनोपॉज,
Pre.
राइट.
जी.
From 40 to 45 is perimenopause.
जी.
And, and after 45, there can be menopause. But if it is beyond 52, in Indian scenario, it is late menopause, which is abnormal. So one has
Okay.
to understand this.
अच्छा.
So perimenopause, the transition is there for
Hmm.
nearly 5 years from
जी.
40 to 45. Like, so one has to be aware that, and if I'm getting some of the menopausal problems like irritability, whether it is mental symptoms or emotional symptoms, or the sexual problems, or maybe the physical problems like lethargy or exhaustion or
Hmm.
irritability, or maybe sometimes depressive phase, or maybe loss of self-esteem,
जी.
loss of confidence, I must
Hmm.
say, or maybe जिसको skin, like हिंदी में
Altered
शब्द है
skin and dry.
त्वचीय लावण्य का कम होना.
अच्छा. Elastic, is there elasticity of the skin? Yeah, collagen,
It is
less
it is
collagen, something like that.
like it is, I must say, the dryness of the skin, the
Dryness skin.
lustriousness, and the
Yes.
shining, glow अपन बोलते हैं,
Glow.
right?
Yes, yes, yes. Natural glow. अंदर से within वाला glow. Got it.
So,
Got it.
oh, and here. So, I have done plenty of research in this area, in Indian
जी.
scenario, and every
Okay.
time when I go to the World Congress, I
Hmm.
present my own data also.
Okay. Okay.
So, one of the research was related to the symptom clusters. So, when
Okay.
you are talking about symptoms, you say that some of the women, they have this moderate problem, some of them they have severe problem. So, there is not a single problem. There are clusters of problem, and
Okay.
for that reason, I always give a health questionnaire to my women,
Hmm.
those who are stepping into
जी.
my clinic,
Hmm.
that they might forget about कि ये भी हो रहा है वो भी हो रहा है. So what happens before they come to come for my consultation, they are given that form, and that one they have to fill it up, just tick mark. So then when they are stepping in and talking to me, and when
Hmm.
I'm counseling them, they are already aware, and they, what they say, मैम हमें तो पता ही नहीं था ये सब भी मेनोपॉज की वजह से हो
जी.
रहा है. हाँ ये
जी.
भी हो रहा है. हाँ ये भी हो रहा है. हम तो सिर्फ ये दो प्रॉब्लम आपको बताने वाले थे. नाउ वी
जी.
नो. So when I see them, there is a group of musculoskeletal problem, there is a
Hmm.
group of skin, hair, and teeth problem, eye problems, group of genitourinary problems, sexual difficulties,
Hmm.
vasomotor problems, and bony problems.
Hmm.
So when I see which of the group she is being, involved into, and which of the system is involved into,
Hmm.
then I take it further that
Okay.
yes, for this reason, I need to give you this, I need to counsel you this. For this one, you might have to prevent osteoporosis. And then the most important part of my consultation, which is very, very needed. And from your platform, I think whosoever is listening, one has to have the risk score assessment related
Hmm.
to NCDs. When I say NCDs,
Hmm.
this is non-communicable diseases, which include heart disease
Hmm.
or heart attacks in general, if we say,
Okay.
breast cancer, osteoporosis, Alzheimer's. So these are the cognitive disorders, like brain fog. एकदम
Hmm.
से जैसे धुंधला आ
Hmm.
जाता है. Brain
जी.
fog का
जी.
मतलब है हम में एकदम से भूल
Yeah,
जाते हैं.
that
हमारे
confusion
सामने
and
पर
not the clarity.
and
Hmm.
confusion. There is, you are unable to take decisions. You forget names. चाबी
Hmm.
मैंने कहाँ रख दी थी. गाड़ी की चाबी कहाँ है. कहीं मैंने लॉक बंद तो नहीं किया. दोबारा दोबारा चेक कर रहे हैं.
जी.
सामने पर्सन आ गए हैं, नाम याद नहीं आ रहा है. कई बार यू फॉरगेट कि मेरे को फ्रिज खोल के कुछ निकालना था, एंड सडनली यू रियलाइज कि मैं तो भूल गई कि मेरे को क्या निकालना था, राइट?
मैं तो
सो
जूते लेके खड़ी हो गई थी फ्रिज के आगे कि मैं क्या करने आई हूँ. लाइक ये किस लिए यहाँ नहीं रखने थे. सो यू आर राइट. यू स्टार्ट नोटिसिंग दैट छोटा छोटा.
Chota, chota.
Yeah.
So these are the group of problems. So when I entertain my patients, when I see them, I must say it's a mature women health screening.
Yeah.
I would never say कि health screening disease के लिए कर रहे हैं. This is
जी.
called as well woman screening. You are well. You look
Hmm.
well. Everything is fine with you, but you want to remain like this,
जी.
right? For
Yes.
that reason, this is the right time to break the menopause mindset की bias mindset, I must say,
Hmm.
कि ये तो menopause है तो हो ही रहा है तो होगा ये तो ऐसे ही होगा. No, no, you can prevent. You
जी.
can deal with
True.
it. You can
Hmm.
cope with it positively. So all the long-term consequences of menopause, as I said, the NCDs like obesity, most
Yes.
important. बस common myth है कि menopause हो रहा है और पीरियड नहीं
मोटे
आ रहे
होंगे.
हैं तो पेट तो भारी होगा ही, मोटे तो होंगे ही, साफ नहीं हो रहा
जी.
है. So it's like totally,
Hmm.
totally not acceptable, this type of thinking, because
Yes.
your life has become sedentary now. You were so active before. Now your daughter-in-law has come, she's doing, you are just sitting and just eating or parties kar rahe hain, and you are just like, leisure
Our
time.
mother-in-laws
So
are not going to like you for this. Your daughter-in-laws come in and you are sitting.
So
Yeah,
whatever
please.
reason your life is not so active now, what
जी.
you were before. So you
Hmm.
आपका input तो बढ़ रहा है और
जी.
output कम हो रहा है.
कम हो रहा है.
So
True.
weight तो बढ़ना ही बढ़ना है, और that
जी.
too आपकी जो central obesity है. You must have seen people, the women, उनके हाथ and पाँव तो दुबले हैं और सारा weight center है.
जी. जी.
That is very, very dangerous. There is a term metabolic syndrome in which there is obesity, hypertension, diabetes, and these women are more prone to cancer. So, if any of the women, those who are listening today, this awareness or whatever unfolding of your myths, or
Yes.
so they must realize that this obesity is very dangerous. The central
जी.
obesity we call it is कि हमारी पहले pear shaped body थी और अब क्या हो गई, apple shape.
Apple shaped हो गई.
So that is also very dangerous.
जी.
And then we do BMI, that is body mass index. उससे भी पता चल जाता है कि क्या
जी.
किस कैटेगरी का मोटापा
हम्म.
है.
हम्म.
And then according to that grading of our BMI and degree of obesity, we give them solutions to how to decrease the weight, how to maintain, what are the things you can do.
हम्म.
So
But again, ma'am, just a related question here. Myth is that you will gain weight during menopause and it's difficult to shed. It's a myth, right? With healthy diet, exercise, lifestyle, it is absolutely possible, and there is no way. It's not given कि आप because you are in perimenopause आपने weight gain करना ही है. This is the excuse, right?
absolutely.
Right.
So
Absolutely.
the second,
Absolutely.
we have I think we have busted the myth of obesity. We have busted the myth
Yes.
of natural menopause or artificial
Yes.
menopause.
Yes.
We have also busted the myth of, कि transition तो stormy होगा और
जी. जी.
and
जी.
age
जी.
भी अपन ने बता ही दिया
जी.
है.
जी.
So I think the another important, which is very sensitive issue, is sexuality.
Yes, ma'am.
Very,
Sexual
very
health.
important.
Sexual health
Sexual
पे
health, and
absolutely.
the decrease in libido, and marital disharmony and all those things. So
Yes.
one has to not put the taboo that my femininity has gone, or I cannot be so active now, or maybe it will be I will be called as a filthy woman, or
Mm,
all
mm,
those things. So don't ever put the taboo of menopause with sexuality. It doesn't go together. Only thing that you have to take care of your genital system, and there are remedies available which are helpful for your marital harmony and also keeping the sexual health alive.
mm.
Because in my group of women, in my research data, I have seen the 50% of the women, they do have sexual problems. They don't
Yes.
come.
Yes.
And even unfortunately, even the doctors, they don't open the Pandora box.
Yes.
They don't open.
Ma'am, you're absolutely right. This brings me to the first report that we did on menopause industry report. We released with 20,000 women. around 36% said that their sexual health is affected and they want to talk about it, but doctors से बात नहीं, they themselves don't talk, and ये क्वेश्चन शायद उनसे पूछा भी नहीं जा रहा, ये
Exactly.
क्वेश्चन मिस हो रहा है
So what
when they're
I
going for
do with my
diagnosis.
patient, yeah. So
Yes.
what I do with my patient, that I just pass three questions. Are you active or not?
Hmm.
If you are active, do you have any difficulty?
Hmm.
If you have difficulty, which type of difficulty? That's
Hmm.
all. That's
Hmm.
open up. And out of these, 50% of the women they do have,
Yes.
50% they have loss of libido. And of those 50%, they have partner difficulties too,
Yeah.
right? So
Yeah.
one has to not,
Hmm.
every females की typical होती है हर चीज अपने ऊपर ले लेना.
जी.
This is all
जी.
because of me, all because of me. So we should not consider,
Yeah.
because there is a term of andropause also, which is a
Yes.
proven. I'm the
Yes.
one of the active member of European Andropause and Menopause
Wow.
Society, and we do
Wow.
discuss all those. And nowadays, we don't call menopause or andropause in terms of sexuality, we call couple pause.
Oh, that's a nice term, ma'am. That's a very nice term. Okay, so
So,
we learned
all
something
those
new
males,
today.
those
Couple
who are
pause.
listening, they should understand.
Yes. We will use it more often now. Couple pause. Are you in couple pause? Okay.
Absolutely.
Yes.
So
This
don't
is
ever put
amazing.
everything on yourself and your health and your this
Yes.
thing. No, no.
Yes.
We doctors are supposed to dig into the couple. Like in infertility, it's not always because of the female there is
Yes.
infertility. 50% of infertilities are because of male. So
Hmm.
why this time the males are not being,
Hmm.
taken care of,
Yeah, yes, they need to
right?
step up. True,
So they have.
absolutely. Hmm.
So what I have to say is it is underreported, undertreated, and neglected.
Yes, yes,
Okay.
absolutely.
So
We've heard
I
those narratives now. आप सही कह रहे हैं, when we were told कि a lady, from the sexual health perspective, वो कह रही है मैं हर तरीके के बहाने, you know, for him to not take the advance, or just ignoring his advances, कि मैं थकी हुई हूँ या नहीं, अभी मूड नहीं है या बाकी सब है. But when we go deeper and try and understand in counseling, we understood कि she's feeling conscious because she's gained weight. Maybe she's having vaginal dryness. Maybe it's vaginal trophy because of which the thinness is there. So there are so many things, but she's not able to communicate. वो अपने partner को भी नहीं बता रही है कि this is the problem, because she's feeling the pressure. And so yeah, it's a sad
there
state.
are factors like loss of self-esteem because of the body image.
Yes, yes.
Then there are factors like uh, she's she's having a fear of getting hurt because there is dryness.
Mm, mm,
Then there are factors like um, maybe some of the women they don't want because of infidelity or anything at this
yeah,
particular age.
yes.
So there are so many
Mm,
psychological. So it's a
social factors.
biopsychosocial approach which is needed for this
Mm,
particular aspect. And we at International, because I'm working at International Menopause Society for the last 18 years,
mm,
we have come out with the global statement on management of these disorders,
mm,
and what is the role of testosterone, which is a male hormone, is we have
yes.
also come. And there is a term which is called as genitourinary syndrome of menopause, that is
Mm,
GUSM. That
okay.
includes everything. That includes the most distressing problem of stress incontinence की
Mm,
जोर से छींक से जो भी मैं वो भी मैं चाहती हूँ इस प्लेटफॉर्म पे
mm,
फीमेल्स को बताऊं कि this is a very distressing problem which females usually don't disclose,
or
कि
talk about,
while
yes.
sneezing, while coughing, while laughing, few drops of urine
Mm,
leaks. So
yes.
this can be because of the again estrogen deprivation in the area of urinary urogenital area. So
Mm,
these all are treatable. These
जी,
all are treatable. We have
absolutely.
wonderful medical and surgical management. Even the lasers are available
Mm,
nowadays.
Hmm.
all sorts of ointments, hormonal therapy, systemic or local, or maybe lubricants. Everything is available.
Yes,
But you
absolutely.
have to come out and the solutions are there.
Yes.
So
Yes.
the next taboo, the myth is
Your sexual life is going to
fertility.
be over during menopause or after menopause, and
No,
that's actually
no,
going to be relief
no.
for a lot of
Often,
women and
very
men.
often, to be surprising, not surprising. I really admire because there is no fear of pregnancy. Some of the women they enjoy more.
Yes, yes, we have seen that also.
And
Yes,
also the because the children have gone out,
yeah.
no privacy issues are there,
Mm.
especially in cosmopolitan, big
Yes,
cities and all
absolutely,
those things.
absolutely.
So and there is a cogger phenomena. That means you don't have to label that it is not good and
Mm.
to have the fantasies and all those things. So this
Yes,
is also one of the things.
yes,
There is another group of women, those who are really worried in perimenopausal period, that we don't know when the periods are over and our periods are regular, and they are in the fear of pregnancy.
yes. That actually, I wanted to ask that question, ki ma'am, there is a myth that you cannot get pregnant, but what is the right answer that during your perimenopause phase, especially when you're having irregular periods, or maybe can you get pregnant, or should you still be taking your birth control pills or any other contraceptives or anything for birth control? Should they be worried for that?
Definitely, there are sporadic release of ova, and she can become pregnant. So, till after 1 year of menopause, one should not stop any protection.
Okay.
सो दैट इज इम्पॉर्टेंट. एंड इसका एक दूसरा पहलू और है, वो बहुत ही आज के इस सिनेरियो में बहुत ही जरूरी है ये बताना कि
जी.
मेनोपॉज इज नॉट योर एंड ऑफ फर्टिलिटी.
Hmm.
Because of the girls are getting married late, and they don't plan
Lifestyle and
pregnancy,
जी.
and sometimes they literally, when they pass into the phase of menopause, by the time they plan, so what should they do? So my message to them, there are options: freezing of the embryos, and we have enough assisted reproductive technologies advanced. So one don't have to consider that, oh, if I am menopausal, I cannot bear pregnancy if it is needed. Although
Hmm.
we don't advocate that the women should become pregnant at this age, but you must have seen
Hmm. Hmm.
surrogacy, you
Yes,
know,
yes, yes,
and you must have seen in the newspaper that one of the mother has given birth for her daughter. She could
yes,
not bear.
yes, yeah.
So this is also something very, very important, that one must understand that anytime she can become pregnant accidentally, which is not required, non-accepted. But on the other hand, if you are menopausal, maybe we can help you out if you're really, really in a need, or because of any circumstances you want to
Hmm.
bear more pregnancy. So
Got
that is
it.
also one of the myth which we have
Hmm.
to break.
Yes. Ma'am,
So
that also brings me, since you have worked with the international organization, you've been an instrumental part with the International Menopause Society, कि नंबर ऑफ सिम्टम्स कितने हैं मेरे को खुद बहुत जैसे कई बार होता है आई आल्सो स्टडी द गुड वर्क दैट यू डूइंग एट डिफरेंट अदर मेनोपॉज एसोसिएशंस इंडियन मेनोपॉज सोसाइटी सेज 38 symptoms right American menopause society says 108 symptoms UK menopause society says around 57 अभी लेटेस्ट जो एड हुआ है फॉर यूएस इज ADHD and bipolar disorder. Now, these are like heavy words, and यहाँ पे when I speak to doctors in India, they think कि नहीं, it's too crazy for them to just keep adding everything and label it as perimenopause or menopausal symptoms. What is the take of International Menopause Society one? Uh, and I continue to that. I really want to know some of the crazy symptoms that you heard about. क्योंकि कई बार लेडीज को कॉमन सिम्टम्स जो है 8-10 उसके अलावा वो सिम्टम्स ही नहीं पता होते जैसे आप हम बात कर रहे थे कि उनको पता ही नहीं कि मेनोपॉज या पेरी मेनोपॉज का सिम्टम हो सकता है. सो some of the crazy ones that you have heard, felt, or maybe experienced or heard a story. So that will be the second part.
Mhm. Yeah, giving the answer of your first part is that International Menopause Society or any of the organization, International
Okay.
Menopause Society is the organization of around 87 menopause societies across the world, and that is
Okay.
called as Council of Affiliated Menopause Societies. I was Secretary General of that.
Yes.
So in that, when we gather to our congresses and we present our data from different countries,
Hmm.
they are all related to nothing is fixed.
जी.
Ethnicity, social cultural
Okay.
background, your dietary habits, your genetic pattern. This there is nothing like fixed, and every time we present our epidemiological data
Hmm.
having difference in different reasons.
जी.
Uh, in Indian scenario, when we are working here, I found if I need to categorize, I will categorize psychosomatic problems,
Okay.
musculoskeletal problems,
Hmm.
genitourinary problems,
Hmm.
three main groups,
Okay.
maybe physical component and mental component, if you just
Okay.
further.
Okay.
Then there is a associated medical illnesses which causes symptoms. You know
Okay.
what I'm saying?
Yes.
If a
Yes.
lady, if a lady is passing menopause
Hmm.
or she is menopausal,
Hmm.
she's already diabetic, she will
Hmm.
have more genitourinary problems because
Got
the
it.
sugar is passing. If she is having heart problems already, she is having, then she might suffer more heart, palpitations and hot
Hmm.
flushes.
Hmm.
So one has to consider in toto, it's not only the menopause, there is a mixture, as I said,
Hmm.
cluster of problems, and
Hmm.
also not only clusters, the overlapped problems related to any psychological. Suppose a
जी.
lady who has postpartum depression,
Hmm.
she is more prone to depressive episodes during menopause. A
Got it.
lady who a lady who has gestational diabetes
Hmm.
means during pregnancy,
Hmm.
she might end up with metabolic syndrome and more. A lady who has PCOD
Hmm.
before, then she is more prone to have cancers or all those things.
Hmm.
So they are not segregated group, they are clusters and overlapped with the medical conditions. So
Okay.
you cannot label that this is, these 50 symptoms are for menopause and these for 10 for this. No, this is overriding. As
Okay.
I told you, there is a DSM classification for
Hmm.
depression, and there is a grade, molecule quality,
Hmm.
MRS scale.
Hmm.
They all are different tools to for the research purpose to present the data. For the
Okay.
practical purpose, any of the women can have any problems if she
Yes.
has taken solution some steps or
Hmm.
some healthy solutions. She might not have any much more severe problems. The
जी.
one who is in already medical problems, she might suffer more problems. The
Hmm.
one who has already psychological problems, she might suffer with more, sleep difficulties, which is a very big problem for
Yes.
menopausal women to have sleep
जी.
difficulties.
जी.
So
Got it.
there is not a standard, group of problems that one must have or doesn't
Hmm.
have.
Hmm.
The same thing is for the treatment. One size doesn't fit to all. That's why we say that the symptoms are different. Every woman is having a different set of
Menopause.
symptoms.
Hmm.
We have to deal women with individualistic approach.
Yes. Absolutely. Absolutely.
And
Yeah.
in layman language, I will say it's a boutique shaped. It's a
Yeah.
boutique like a offering, no?
Yes.
You want
Yes.
this, you have this problem,
Yes.
I need to give this.
Yes.
So one size doesn't fit all.
Yes. Yes. That's so true, and that is why it is important. क्योंकि कई बार क्या होता है कि as you said, even in context of your hereditary कि mother को नहीं हुआ, but the daughter is having it. Every menopause is unique. Their journey will be unique. Every woman's journey is going to be unique for that. And how your lifestyle, how your food habits, how your exercise pattern is, and what you have had earlier, stress या पीछे से अगर आप weight gain or any other issue that you've been carrying on, as you mentioned, that is going to cause a lot of other problems also. And hence, the solutions have to be unique to everyone. कि अभी आप अर्बन में हो, रूरल में हो, टीयर 1 2 3 में हो, जॉइंट फैमिली है, वर्किंग में हो, एक
Absolutely,
बच्चे है, नहीं
absolutely.
है, what are your choices? A lot of things will depend. Truly,
And
truly, that's
nowadays, there is a very important area, and we clinicians have a bigger responsibility for our patients.
जी,
Not, I will not say these are patients, these are women with
women.
menopausal
Yes,
problems only.
जी,
So that is menopause and workplace. It is very,
yes,
very important. Like
yes,
women are at peak at this time, those who are
yes,
working,
yes,
and their work pattern really becomes difficult with menopausal problems. So I think nowadays our mission of International Menopause Society and even Indian Menopause Society, we want to have a proper workplace,
policies. Yeah,
policies,
yeah.
and that's why we have developed already some of the policies, and we are being applying those, and also at grassroots level,
Mhm.
which I have also initiated. This is a unique initiative which I started again,
Okay.
that the आशा सहयोगिनीज जो हैं
जी,
गाँव में हम
okay.
उनको ट्रेन कर रही हूँ मैं अभी
Wow,
अभी लास्ट मंथ आई हैव ट्रेन्ड 100 आशा सहयोगिनीज
wow.
for menopausal healthcare problem, because each
Okay.
Asha Sayogini is having 10 or 15 families
Yes, yes.
responsibility to. I thought that is for the rural population. So the
That's
mission is
amazing
to reach,
initiative.
yeah, the mission is to reach the underprivileged also.
Yes,
On the
yes,
one hand, the menopause at workplace, the working women, highly alleged women, intelligent women, educationist women, and on the other hand, innocent, hardworking, sitting in
yes.
the rural
Yeah,
place.
yes,
So every woman needs attention. I
yes.
always say at this age, women needs attention, assurance.
Yes. No, this
And
is absolutely amazing, ma'am. And I mean, this goes without saying. Anything we at MenoVeda or otherwise, we would love to be part of your mission and your vision. And I think यही compounding effect होता जा रहा है. Like I've been speaking to a lot of experts. All of them are on a mission where they are trying to just normalize the conversation, bring the topic in upfront that at least बात तो करो, those kind of things. And it's just so amazing to see. And you guys are inspiration. You're the torch bearer. We are right behind you. So,
no, no,
but we
I
will be
always
there.
feel that
Oh,
now at last, for after 27, nearly 30 years of hard work, now
mm,
the menopause has taken a right importance, which is supposed to be
yes,
there. Because I always say, even the young generations, my students, because I'm professor and work for both private and medical colleges,
जी.
so I always say it is, every woman is, maybe she will not become mother, she will not pregnant, she will not, but every woman has to pass the menopause.
I
So
always
it's
say
a,
that, ma'am. I always say that. I think maybe I
so
picked it up from you, but yes, you're right.
yeah, so every woman
Uh,
will pass through menopause. So it has lot of scope. One must
yes,
involve in menopausal
yes,
healthcare modalities
yes,
and
yes,
all these, solutions, giving the solutions, because each and every woman under this earth will pass menopause.
ma'am, this is so amazing. From a just taking a detour here, from a investor's perspective, we have been speaking to some investors lately. Everybody says, no, no, it's not enough, big enough market. And I keep telling them, every woman on planet will undergo menopause. Please understand the number.
Absolutely,
And she'll be
absolutely,
spending one third of her life in this phase. Why do you think
absolutely.
the the TAM, as they call, the total addressable market is small? We're talking about 50%, and we have not even touched on the topic of LGBTQ community and them and their menopause, right? So the percentage would be more than 50. But for some reason, they think that it's not a big enough problem. It's not a big enough age group. I don't know why, but I think it's
So,
us
so
women only who have to start demanding it. Then they will get the
absolutely.
attention.
That's what I already said to you. It is
Yeah.
underreported, undertreated,
Mm.
means, neglected area of
Yes.
this one. But
Yes.
I'm really glad that working in these all organization, North American Menopause Society for 3 years, and British Menopause Society, and European Andropause and Endocrine
Mm.
Society, and also the International Menopause Society, globally there is a big revolution, and big
Yes.
awareness has been spread from all across these organizations. And I'm
Mm.
happy to say again that on each World Menopause Day, which is on 18th of October, and
October.
each October is World Menopause Month.
Mm.
So we do run campaigns, internationally campaigns, and I'm
Yes.
again glad to see that I'm always the part of making the posters and leaflets, and
Yes.
across the globe, the NRI. I'm so glad the NRI women, they read the Indian
Yes.
translated,
Yes.
posters.
Yes.
And so
Yes.
every time we take one part, like one time mental health, one time sexual health, one time cardiac health, one time this
Bone health care.
premature
Yes.
ovarian. So
Yes.
these are the things we take out, and then particularly on this area, on this particular aspect of menopausal health care, we work. So it
Yes.
is completely a comprehensive menopause management which is needed for these women at this
Mm.
particular age, which includes a multidisciplinary or a transdisciplinary or an interdisciplinary approach.
Mm. Yes.
This is
Yes.
again
Very well said.
because we believe in India holistic healthcare, and
Ji.
I would say that yoga is the wonderful thing. And I always say now those fire wire together.
Yes.
So you have to connect, and then you have to work for your happiness, health, and of course, our slogan of Indian Menopause Society is fit at 40,
Mm.
strong at 60, and independent at 80.
Wow. Oh, that's a good slogan. Yes. Fit at
And
40.
I always
Yes.
say
Independent
clinicians
eating.
should open the door
Mm.
for discussion, for information, for counseling, for treatment, and proper diagnosis and risk assessment for all these women. Help them to stay fit forever, feminine forever, and young forever. That's my.
Awesome. Awesome. I want to just ask you two more quick questions before we go into the closing one. Uh, One is that's again a myth. I don't know if it's right or wrong. Is there a confirmatory test? Because nowadays, a lot of tests come in. I really wanted to ask you this. I don't know if you don't want to answer, it's okay. But is there a
No, I
confirmatory
will answer.
test?
It is again
Is
a
there a
myth. It comes in the
yeah,
myth.
it's is there a confirmatory test that you're in perimenopause? My understanding and what I've read and my research says that there's a confirmatory test that you are postmenopausal, but there cannot be a confirmatory test till the time you reach that 12 months and 1 day. So your take.
I must say there is nothing like a test which I will say that you get it done and I will let you know that you will have menopause at this age. Nothing like that. It's just how you feel, and 1 year of menopause, 1 year of no periods confirms that you are in menopause.
Hmm.
Now there is menopause. Of course, there are tests which support which are needed for HRT, that is pre-HRT screening, because we have to know that what are the hormonal levels now and after how much, and
Okay.
how much dose, and for how long we have to give. So we do prescribe some hormonal test if we are prescribing any therapy. And of course, for research purposes also, suppose if
Okay.
someone is taking something and they want to see whether it is effective or not. But
Mhm.
by and large, there is no test, and it is not needed. It is not
Yes.
needed.
Yes. Okay. Okay, thank you for
It is
clarifying.
needed. It is needed if you have early menopause.
Yes.
Like if is the 38 years पे अगर periods बंद हो गए हैं
Hmm.
तो हम सारे टेस्ट करा के आपको बताएंगे कि ये अब periods आएंगे या नहीं आएंगे
जी
और क्या कारण हुआ कि आपके जल्दी बंद हो गए।
जी।
एंड उन सब के लिए हमें टेस्ट कराना ही पड़ेगा,
Hmm.
हार्मोनल टेस्ट और दूसरे भी टेस्ट जो those which are needed to prescribe you the right medication, because any woman who is having premature ovarian failure means जिसके 40 से पहले पीरियड्स बंद हो गए हैं उसको हमें हर हाल में टिल नेचुरल एज ऑफ मेनोपॉज उसको हमें देने ही पड़ेंगे,
जी।
because it is needed for her,
Yes,
not
absolutely,
after.
absolutely, absolutely. And second last, I think I asked you earlier also, one crazy symptom that you never thought कि ये perimenopause या menopause का symptom है, but it is part of that. Because we hear stories of कि मुझे ऐसा भी feel हो रहा है, वैसा भी feel हो रहा है, you know, all those. So the least known symptoms are the crazy ones that you heard.
I think I will say there is a like a core brain syndrome in my group of women,
Okay.
which is a vicious circle. And the most of the women they don't understand what is happening, but it is a vicious circle that is depression, sleep difficulty, and hot flushes. पेशेंट
Hmm.
को दिन भर हॉट फ्लशेस आए, रात को नींद नहीं आई, रात को सो नहीं पाई, तो सुबह उसकी एफिशिएंसी खत्म हो गई तो डिप्रेशन में चली गई। तो शी इज नॉट अवेयर दैट इट इज पार्ट
Hmm.
एंड पार्सल ऑफ दिस विशियस सर्कल व्हिच शी इज पासिंग थ्रू।
Hmm.
सो one has to identify that hot flushes to be dealt with. You have to correct your sleep difficulties, then you can come out with your all mental symptoms also. So
Hmm.
don't label कि ये तो होगा ही होगा और अब तो मैं even you know husbands, even the children, they will say ये तो बिल्कुल ऐसी नहीं थी पहले, अब इसको क्या हो गया, अब तो चिड़चिड़ी हो गई, बात बात में गुस्सा करती है, रोने लग जाती है, बिना किसी रीजन के रोने लग जाती। एंड मुझे तो एसी चाहिए होता है और फिर इसको तो ठंड लगती है, कभी एकदम से हम जब ठंड हो रही होती है तो ये एकदम से she fell
Correct.
into perspiration. So
Correct.
these are the things which are common, but one has to understand. And through this platform, I will convey this message and I appeal to all the family members. Please try to understand your mother, your wife, your sister, or anyone female who is passing through this stormy transition, that it is not her fault. It is all hormones which are bringing this change.
Yes.
Your support is needed, your care is needed, doctor's assurance is needed, and the most important thing, if you want to celebrate Mother's Day, give her a membership of gym on that day, present
Yes.
her some, you know, well women screening package and get her complete health checkup to
Yes.
remain, she so that she can pass her second adulthood in a very golden phase of life. So that's my message.
Thank you so much. Such a lovely message, ma'am. And thank you so much for this session. And coming back to the crazy symptoms, I personally felt एक ना जैसे चीटियां चल रही, tingling sensation. And for the longest time, I
It's
used to feel, I don't know, but only till the time I found it as part of the perimenopausal
No,
symptom list, I was like,
I
okay, I'm not
appreciate
crazy.
Tamanna. I appreciate Tamanna. This part we have not discussed. Most of the women, they have B12 deficiency and vitamin D deficiency, and this can cause this. So I
Okay.
always appreciate that the women should check their vitamin B12 and D levels. And even if you are taking calcium, if you are not, if your vitamin D is not sufficient, the calcium will not be
Not
absorbed
good.
and your bones will
Yes.
remain weak and you might fall into osteoporosis and fracture. But if you are taking vitamin D also and calcium also, still your bones are weak. What is the reason? You are not taking vitamin D properly because vitamin D requires
Fat
fat
soluble.
for
Mm.
absorption. It's a fat soluble vitamin, and calcium is
Yes.
needed for vitamin D. The calcium is needed,
For it to get
vitamin
absorbed
D
better.
is needed for calcium, and for calcium, fat is needed. So you can
Yeah.
pamper yourself once in a week, good butter toast or good paratha, and absorption of vitamin D will be
Yes.
there. And of
Okay.
course, supplements, vitamin B12 you have to have, because if we are vegetarian, we are deficient of these two.
Yes.
Those who
Yes.
are taking fish and all, they are good at this. So
All
this
right.
has brought to the very important message. Your symptom has highlighted this.
No, no. Yes, absolutely. Now it is highlighted this, and I can now connect the dots. But that was like crazy time. I used to just feel that what is happening, and I would get up at even the middle of the night just looking for it. कि नहीं चीटियां हैं and say क्या है, what is it, and no, it's not there. And then it started happening in daytime. So I always ask my guests, what is that one crazy symptom? I hope I'm not the only one who has all the crazy ones, because मेरे को सारे ऐसे ऐसे symptoms थे जो ज्यादातर लोगों को नहीं हुए. So I think काफी exceptional निकले. So I just wanted to know that. But on that note, thank you so much, ma'am. It's just a pleasure. It's so much pleasure, and it's an honor to have you. And it's always enlightening to know from you and to learn from you. And it's our best wishes. We know that you're going to be the torch bearer. You are leading the way, and you're following you. But keep inspiring. I think that's the only thing I can say. Thank you so much.
Thank you, Tamanna. I thoroughly enjoyed to talking with you, and I think you have given me opportunity to give messages which are very close to my heart, which are always I feel responsible through your platform. I think many of the women will be benefited, and thank you for giving me the opportunity. And all the best for your future endeavors and
Thank you,
doing
ma'am.
work in this field passionately. Thank you so much.
Thank you so much, ma'am.